Everybody, and welcome to the webinar arranged by the MIT Institutors. My name is Dr. Saadia Izzat. So I can see we have 31 participants. So if I subtract the Med Institute people and myself, so I think we have 27 in total. Most of them I can see from the chat box are appearing in May. So like you guys have 2 months, which for those who has done their research, they know the what kind of exam it is, what they are expecting to do there. So 2 months are more than enough, I guess. For those who are preparing for the first time, I would recommend them to start the preparation for at least 4 to 5 months. And those who are repeaters, 2 months or even 1 month, if they know the tips and tricks, are more than enough. So inshallah, all of you will pass this time, because the exam is, trust me, exam is the most easiest part of the MRCOG. When I was a student and people were telling me this, because I struggled a lot for past part 3, I will tell you in just few minutes. That time I didn't realize that. But once you pass it, then you know that how easy it is. The only thing is you need proper guidance. It's the easiest part, provided you have the knowledge about tips and tricks. It's UK, all exams 50 to 60% are the recalls. So recall type part is the easiest way to do. They just make a few changes in every recall every time, but it's not like too much. And the thing is, OB-GYN is not a very vast field. The good thing about this field is, so you have, suppose I take one module, we have only 4 or 5 topics in that. You come across those parts every day in your hospital. I have never done any shift in my hospital in which I have not received an early pregnancy with complication. There is no such shift in which I have not received any woman with menorrhagia. Every time, you name it and you will come across that case. So it's just like going and seeing 14 patients, but in the way UK people are doing. Okay, so let me introduce myself first. My name is Dr. Saadia Izzat. I did my MBBS from Khyber Medical College, Peshawar. And after that, I was working in a medical college for 2 years. In that time, I was preparing for my PLAB exam. I did my PLAB 1, PLAB 2. I went to UK, but unfortunately, due to some family issues, I could not register with the GMC. I came back to Pakistan, got a government job. At the same time, I enrolled myself in the MCPS because that was the easiest and the fastest way to get into a training. And I did my MRCOG-1. So once MRCOG-1 was done, my MCPS 2 years, I was busy with training. I could not attempt part 2. So once I passed my MMCPS, I did my hard licensing for the UAE, but because I always wanted to work abroad anywhere in the world. So fortunately, I got the hard license. I got a very good opportunity in UAE. Since that time, I'm working as a registrar in the biggest private setup in UAE. Then I attempted my part 2 while in UAE. I cleared that, alhamdulillah. Then my first attempt of MRCOG-3 was in 2019, just before the COVID November. That was, trust me, I just gave the attempt with 50 or 60% of the preparation. I didn't know much about the exam. Still, I managed to get 58%. That was very encouraging at that time. Then COVID happened. For 3 years, there were no exams. And then for 2 years, I could not get a slot for the part 3. So I was away from the books for almost 5 years. Online exams, they offered me, but for me, I thought that I was not a person who can go for a online exam. So I just skipped few slots. But May 2023, I decided that now it's going too long, so I would just go for the online exam. I appeared in an online exam. Again, I prepared very well. That was my 100% preparation, but luck was not on my side at that time. I was quite happy after the exam, but then they called me that because there was some technical issue, so I have to rerun 2 stations. Then we waited for 2 hours. They were unable to connect. And then they sent me an email that instead of 14 stations, they are going to mark me in 12. That was very heartbreaking. You can't imagine. So when I got my result, I failed only by 1%. Like 62 was a passing, and I got 61. So imagine the kind of a frustrated I was. So still, for few days I was not able to concentrate. I said, okay, that's done. I am not going to appear in the exam any time soon. But still, we are doctors, so we have to like keep in ourselves in the loop. So I appeared and the good thing was, luckily, in November 2023, there was exam going on in UAE. That was a face to face. So I thought this is my type of the exam. So I appeared in 2023 November, and thanks to God, I cleared with 75%. So why I'm telling you all this, that no matter what, at the end you will reach there. Trust me, all of you will pass. Sometimes the luck may not be on your side. For me, it took like 3 exams to clear. This is not something I should be ashamed of. This is, we all doctors, we are used to of failures. Maybe some people are outside our community, they don't understand, but this is what happens. So now further, I want to do something in laparoscopy and fetal medicine. Are you able to hear me?
Yes.
Okay. So now
And we are
coming
live
to,
now.
hello?
Ma'am, we are live now on Facebook.
Okay, that's fine. So now coming to Med Institutors, I have recently joined Med Institutor because I thought this is a platform which are genuinely willing to help the students. And as I told you, I worked in a medical college for 2 years. So I really like interacting with the young people and teaching them. And all, I have time, and I have been like through a lot during my MRCOG journey. So I thought it would be helpful if I can be of any use to any of you. That's going to be help me, myself in the long run as well. So don't worry, we all are here to help you. In the end, you will pass. The only thing is the important tips and tricks, the kind of exam. One thing, note down that the most important thing is UK system. First, you have to learn that what is the UK system. It's same as I told you, just like seeing 14 patients. But in our countries, what we do, you are alone, you are doing whatever you like. In UK, it's the system doesn't run like this. They have a pathways, you should know that they have a, and their ethics, their medical ethics, like on the top. They, the only thing which we are lacking there is some ethics, like communication with the patient, communication with the, and patient confidentiality. It's not like everybody can have the access to the patient notes. They are lying on their bedside and everybody's coming and just turning the page. It's not like this in UK. So this is the thing. Can I have my first slide regarding that exam? Because I think my introduction was more than what's needed. Okay, now coming to domains. 5 domains they are going to test you. Some of the stations, they are not going to test you in all the domains. Maybe patient safety will always be there because this is their utmost priority. They do not want like a person who is flooded with knowledge. They want a person who is safe for the patient, because the NHS is not something, this is a trust, so they have to pay the claims. So they want all their doctors to be very safe, so that if they are not doing any good, they are not doing any bad to the patients. The other thing is communication with the colleagues and patient. It's not a one man job there. You have to involve the related person. So as I told you, what I failed in my May attempt was a communication with a colleague. So imagine, that was that later on I worked on that thing. So patient safety, communication with the related person or the person from the specific specialty is very important. Information gathering, you cannot ask all the information from the patients in 10 minutes, but you have to be very safe. You need to involve the persons, and the overall management which you are giving should be It's not like 100%, but it should be like, and according to the guidelines and according to the talk articles or whatever is the recent things going on. So this is the main thing. First of all, whenever you are going for exam, just in the first 2 minutes, see what domains are they asking from you and what is the scenario. If they are asking you for something like which we are doing postnatal urinary retention, do you think we need to ask whether the patient is going for the pap smear or not? Even it's going to waste your time. So you have to, the presence of mind is very important at that stage. You will learn, and the most important thing is practice daily. Even if you are lacking in the books or the guidelines, trust me, you will still manage to pass the exam. If you are confident, if you know how to communicate and how to present yourself, you need to feel the examiner. The examiner should feel that you are very confident, but at the same time very safe. Anyone, even if you're going to the clinic for any of your consultant, what the patient wants, they want the consultant to talk to them. Same as the role player. The role player has given a script, they have to talk. Previously in some courses which I attempted, like before COVID, some of the people were saying that if the examiner or if the role player prompts you, you are going to lose the marks. No, 10 minutes, they may be having 4 or 5 questions, so you have to answer those 4 or 5 questions. How would you know what they want from you? If you allow them to ask you, only then they will guide you. The same scenario, why I choose this scenario, because it came in my exam. I did all the right things. Then I asked her, why do you have any question for me? At that time she told me that why I was discharged when I was having a problem. Suddenly, that was a presence of mind, and this clicked me that she wants me to talk about incidents report. I said, I will, if you allow, I'll look into your notes. I have started an incidents report, and if there was a negligence from our side, we'll be very open and honest. And then she gave me a smile. If I would not have not asked her what is her concern, I would have lost that marks. So let the role player talk. She has been given a script. She has been given some questions. If you answer those questions correctly, you satisfy the role player on those questions, trust me, you are going to pass. No matter what the examiner is saying, the role player will pass you. This is the thing which I just want to tell you, that let her guide, let him or her guide you. Okay. After every 2 or 3 questions, ask them, do you have any question for me? Am I clear to you? And then she will jump to another question. You will answer that question. Then you will ask her, do you have any other question? Do you have any other concern? She will guide you to another question. And then you will answer that. This is the way you will go. It's not like I am just sitting in the clinic dictating that, see how much knowledge I have. Nobody, even in your practical life, if a doctor is talking to the patient, let the patient talk, the patient will be happy. The patient will be satisfied. Same is the case in exam. It's a two-way, it's a communication, it's not dictation. So please, please, please let the role player guide you. Okay, am I clear?
Yes, ma'am.
Okay, so now who wants to do the station? I will not talk like too much. I would like you people to participate, so I can see what you have studied so far. Anyone, any volunteer who wants to do the station, next station. The 5 domains, I'm going to mark you in that. So anybody? Yeah, Rekha wants to do. Okay, fine. Rekha, you are the first one to say you want to do it, so I will give you a chance. Can I have another slide, please, so that she can see what is the scenario? Okay, this is.
Okay.
So I The scenario may be not that short in the exam. They may give you some information regarding the case, but I have made it short so that at this time you utilize your time. Okay.
Okay.
So, Rekha, 5 domains, 10 minutes.
Any other
We
slide?
already have everybody. Are you able to see the slide?
Yes, I can see. I'm saying that any other slide.
No, no, no. This
But
is the only
there
thing.
is a black box is there.
No, the first one for yeah, this one. So I am a patient. I delivered now maybe 3 days back. I came to ER with pain abdomen, and I have not passed urine for the last say 9 to 12, 10 hours. And on examination, the nurse told me that I told you that I have a palpable bladder and I'm in pain. So initially, if you want me to time you, I'll time you. Otherwise, you can go. It's the first case. I don't want you to, be in a rush. We have a plenty of
Yes,
time.
give
I
me
want
2 minutes. Yes, 2 minutes.
Okay, that's fine.
Hello, ma'am. May I start?
You want me to time you, or you just want to do it like because it's the first time?
No, wait, time I think is a better option.
Okay. Start now.
Hello, Mrs. Arnold. I'm Dr. Rekha in the emergency. How would you like to be addressed?
You can call me Mrs. Arnold.
Arnold, your age, please?
I'm 29 years, doctor.
I can see that you are unable to pass the urine and you are having the pain. Do you want me to call my nurse to pass the water pipe into your, tube into the water pipe to bring the urine out and help you with the pain?
Doctor, I'm in too much pain. Please do whatever you want to because I just want to get away with this pain.
Okay. I will also ask my nurse to give you painkiller. Do you have any non-allergies?
No.
Once you feel comfortable, Mrs. Arnold, let me know.
I'm able to talk, doctor. You can start.
Okay, so Mrs. Anand, I would like to gather few details from you to know your situation better. I will address your concerns. And do you have any concerns and expectations from today's consultation apart from this?
Oh, doctor, I have a baby at home. I just want to go back to my baby. I tried to let it manage myself with some painkiller at home, but it didn't work. So I came to ER.
Mm-hmm. I'm sorry to hear about that. How's your baby is doing?
Yes, doctor, he's doing fine.
Okay, and are you breastfeeding a baby?
Yes.
Do you have enough support at home?
Yes, doctor, my partner is very supportive.
Okay, so can you tell me more about your waterworks problem?
Doctor, everything was going fine. As I told you, I delivered 3 days back. It was a like horrible delivery. I had they did the delivery with the help of a metallic spoon. I have a big cut down below. And I was discharged the same day with some painkiller. I was moving around. Since morning, I was having some problem. I thought that I wanted to go to the toilet, but was unable to pass urine. It's been like more than 9 hours. Now I'm feeling pain. My tummy feels distended, and that's why I came to the hospital because I am unable to pass urine.
I'm sorry, Mrs. Arnold, you are going through such a tough situation. We as a team are here to help and support you. Do you feel the sensation?
Yes, I want to, but it's not happening.
And do you feel empty at end or any leak?
No leak.
Did you pass the good volume of the urine?
Yeah, previously I was passing urine, but I think it was not like sufficient amount. I have to go to the toilet every time.
This is the first time you are having this issue? Any previous
Yeah.
problem during pregnancy before that?
No, doctor. There was nothing before.
Okay. So any issues with the bowel or any bleeding?
No.
Any pain or swelling in the legs?
No.
Okay. So in the last 2 days, you were completely fine, as you told me. And so, how long you were in the labor?
It was like 15 to 16 hours.
Can I review your records for more details?
Yes, doctor. I'm okay with that.
Okay, thank you. What was the weight of your baby?
Around 3.6 kg.
Any epidural was given at that time, or in progenatal block?
Yes, doctor. I took a injection at the back.
Okay. So other than this, how was your pregnancy? So everything was fine
Yes,
during
doctor, it is
pregnancy?
normal pregnancy. Everything was going fine. I came in labor. My midwife checked me at that time. I was 4 cm, but from 4 cm till the delivery it took like a long time. And then they have to apply the spoon and they have to
Okay.
give me a big cut.
Okay. Okay. And do you remember that at that time they use any catheter to, and they advise you to pass urine regularly?
Seriously, doctor, I was in too much pain. I could not remember anything regarding what's happening down below.
Okay. Okay. I will go through your records and come back to you. This was your first pregnancy?
Yes, doctor.
Okay. And any fever or feeling unwell?
No,
Any health issues for which you're following your GP?
no,
And any allergies that you are aware of?
no.
And how do you feel as a new mom?
Yes, doctor, I'm coping well. My partner is very supportive, so I'm happy.
Good to know about that. And thank you for sharing your all these information. Anything else important you want to add?
No, doctor, what? Because I want to go to my baby back as soon as possible. What could be the cause?
Yes, I'm coming to that point. Just do you smoke, and can you tell me about your BMI?
It's like 24, and no, doctor, I don't smoke. I stopped it
Okay.
during the pregnancy, and I'm not happy to continue it anymore.
Okay, thank you so much. So, coming to your concerns, as already my colleague has examined you, and it shows that your tummy is distended because that you are not able to pass the urine. In the medical terms, we called it as when it's a postpartum voiding dysfunction. Have you heard this term before?
No.
Actually, it is a quite common condition. 15 to 25 out of the 100 women experience this. This could be because of some hormone changes and also the loss of the bladder tone and muscle weakness due to the stretching of the muscles when the baby is coming down. And this could be and also you told me that this was your first pregnancy and also instruments were used and big cut was there. So these are the possible reasons of developing this situation, but let me reassure you, with the treatment we can reduce this complication. Am I clear so far?
Yes, doctor. So what you are going to do now, doctor?
First of all, as I told you that we pass the tube into your water pipe to see that how much the urine is you are bringing and how much is left inside the water bag. And also we need to arrange the ultrasound to see that also. We send the urine to rule out any infection. If there is any infection, we will prescribe you antibiotic according to the opinion of the infection specialist. Are you with me so far?
Yes, doctor.
So to manage this situation, team of the doctors will be involved, including my consultant and the urogynecologist who are specialized in this field, and continence nurse, a specialist nurse, and also we will connect you to the counselors and support group to help you to overcome this situation. And and so coming to the management, so according to the volume left in the water bag, we will manage this according to this. Okay.
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 So first of all, we will offer you the painkillers, which will be safe for you and your baby, like in the breastfeeding. And also, we will connect you to the physiotherapist because when the tone is reduced after the delivery, to improve the tone, we will connect to the physiotherapist, and also they will my continence nurse will guide you about the bladder training also. That will help you to encourage and timing the urine also. Are you with me?
Okay. Yes, doctor.
Okay, and also we will avoid any triggers like any constipations, heavy lifting. So these could trigger the problem. So if in case the volume left in the water bag is less than 250, then we will again encourage you to pass the urine in the next 6 hours. But if in case it is more than 250 or up to the 400, we will pass the tube for the 24 hours, and we will see that how you are responding to that. Any
Okay.
questions?
No, doctor.
If in case it is more than 700, I'm sorry to use so many numbers, but I will write it down for you, okay, for the better explanation. But if in case it is more than 700, so we will keep the catheter for the 2 weeks, and we will see that after the 2 weeks how you are responding to that.
Okay.
Okay. And also we will after 2 weeks we will arrange a referral to the urogynecologist also to see that how you are responding to that, because it is very important to treat this condition. Otherwise in the long term it can cause the recurrent water infection and distension of the water bag, and can lead to painless painless urine retention, and can lead to the lifelong catheterization also.
So you mean I'll be having this problem all my life, doctor?
No, I don't mean that. I mean that because most of the time the women recover. Okay, to treat this condition, if we not treat it, then in case these problems can happen.
Okay, okay, doctor. So, doctor, do you think there was any negligence in my delivery that led to this case? What in
I'm
that
sorry.
case?
I'm sorry you feel that way. We will go through your records. All your doctors involved in your situation will be talked about that. We are going to do the independent inquiry, and we will be open and honest if in case we find out any deficiency in your case to avoid such happening in the future.
Okay, doctor. Thank you so much.
I will give you some written information. I will write back to your GP and I will arrange the next appointment with my consultant. And also, we will arrange extra support for you, also connected to the counselor and support group. Thank you so much.
Thank you so much. Very well done. Just in time. You covered everything. Like it was a pass station. Without any doubt, you did like very well. Just few points. When you asked for the allergy twice. See,
Yes,
but you
ma'am.
didn't
Yeah, this
explain
I
the
remember.
latex allergy.
Initially, I asked, again, I asked. Yes.
Yeah, that's fine. But if you have, if you like
To save
specifically
the time.
ask for latex, because you are going to pass the
Mm.
catheter, just to show the examiner that you know here the latex is important. Otherwise, you will
Okay,
go
ma'am.
for the type of the catheter will
Silicone
change.
catheter.
Okay.
Okay.
Yeah, that's very important. You didn't ask me about the healing of episiotomy. Maybe just the pain because she has
Yes,
a
ma'am.
big cut. Okay. So that's what's important. So in examination with per abdomen, you have to rule out that there is a episiotomy is healing well. She's not in pain because the pain can lead. This is the most important. Infection, pain. These are the most common causes for the postnatal urinary retention.
Okay, ma'am.
Okay. Then you didn't ask me like any abnormal discharge, etc. from down because maybe the episiotomy is already infected now by now.
Okay.
Okay, that's thing. These are very. They are not going to fail you on these things. This because we are just discussing, and
Yes,
a lot
ma'am.
of people are listening. So that's why. Otherwise, it's but the healing of episiotomy and allergy is the most important thing here. Okay.
Okay, ma'am.
Then you covered everything. You asked the basic questions. There is nothing I can point out. So it's a pass station.
Thank you, ma'am.
So any question you have for me?
No, ma'am.
So that's very well done. If you keep like you're practicing daily, I'm sure you're going to pass. This is the and do
Thank
the
you for
recent
your support,
recalls
ma'am.
and for the first three, like the last three exams. Another thing, please do not memorize the recalls. Sometimes, from my experience, this time they were not giving any information during the labor ward, and I was like, for 15 seconds, I was what she's not asking me anything. She said, I have no information, continue. So because we have been trained like this that they will give you information, so at the exam you may need, you are expecting the same in the recalls. No, because they know that now it's a telegram, there are so many groups going on. Even the examiners and the RCUG is getting smart. Maybe some of them are the members of the groups as well. So please, presence of mind is very important. Your information gathering was perfect. You took pause. You were not in hurry. You asked the patient. That is very important. I cannot point out any other thing. That was a pass station. Very well done. Very well done.
Thank you, ma'am.
This is your first attempt, Rekha?
No, ma'am. Last time I appeared in the November, but by 1%.
No problem. No problem. I appeared 3 times, so don't worry. Okay. So this time, inshallah, you are going to pass.
Inshallah, ma'am.
I'm really happy. I'm really happy that you are doing. Yeah, you are on the track. So just keep practicing daily 5 to 6 stations. I know 5 to 6 stations. It's quite like doable.
Yes,
So
ma'am.
we still have 2 months, and that's it.
Thank you, ma'am.
Anyone else who has any questions regarding this station?
Oh, ma'am, there is a question in the chat box.
Chat box. When to remove the catheter? So see, the chart is there. It all depends upon the amount of the urine you drain. If there is less than, if the patient has voided or if the patient has not voided. If the patient has already voided the amount, then you have to give her a trial after 6 hours without catheter. Okay, you will just ask her to wait, do your normal activities, drink water, and then we will see whether you are able to pass urine and rule out the infection. In every case, you have to rule out the infection and any risk factor. What are the risk factors? If she's a primary gravida, if she has a big episiotomy, if she had an instrumental delivery. So you have excluded all the risk factors. You have make sure that there is no infection. She's not in pain anymore. Then after 6 hours, you will ask her to pass urine. If it's more than 150, what's this? That chart is available with you. So then you have to give her a 24 hours. After you will keep the catheter for 24 hours, and after 24 hours, you're going to remove the catheter. If it was more than the said amount, then what you are going to, you will have to keep it 2 weeks. And after 2 weeks, you're going to remove the catheter. That's the answer. And even if after removing the catheter after 2 weeks, the patient is unable to pass the urine, then you have to involve the urologist, the urogynecologist. Then they will do, some further studies. They may look into the nerves. So what the problem is. But for you as a gynecologist, you have to relieve her pain. You have to exclude the infection. You have to address the risk factors, and your job is done. Anyone else? Any question?
Ma'am, don't you think that we should give someone else also a chance to play the station?
If someone else want to do the same station,
Yes, ma'am.
yeah, it's okay. If they want to do the same station, they can. Anyone?
So do we have anyone who wants to practice this?
Any
their
other
station?
volunteer who want to practice?
Yes, ma'am.
Can please you write your name in the chat box?
Ma'am, it's Dr. Shaista.
Okay, Shaista. So Shaista, you're also going for the May exam?
Yes, ma'am.
Wonderful. Okay. So do you want me to time you?
As you wish, ma'am.
Yeah, better, because now is the time when you should be in time, so that you in the exam you are fully prepared for that. Okay.
All right, ma'am.
So I'll give you 2 minutes. Just prepare this, and then we will start with your 10 minutes. Let me know when you are ready to start.
Yes, ma'am. I can start.
Okay, start.
Hi, I'm one more minute, ma'am. This is an emergency. Okay. Can I start, ma'am?
Yeah, sure.
Sorry. Am I talking to Mr. Arnold, 29 years old?
Yes, doctor. My name is Mrs. Arnold. I'm 29 years old.
Is it okay if I call you Arnold?
Yes, doctor. That's fine.
I can see you are having pain and you are not able to pass urine, although you had delivery 3 days ago. I'm going to ask my nurse to pass a tube in your bladder, that is a water bag, to relieve your symptoms. Is that okay?
Yes, doctor. That's fine.
Mm-hmm. Do you have any allergy? I would like to give you the painkillers as well. Would that be okay?
Yes, doctor. That's fine. Do whatever you want to do.
Okay, all right. Are you able to talk now?
Yes, doctor. Much better.
Mm-hmm. I can see you have gone through a lot. Can you tell me more about your delivery? What happened exactly?
Yes, doctor. I delivered 3 days back. Everything was going normal. I came in labor, and I took injection in the back, and it was a long labor, maybe 14 to 16 hours. But then I delivered normally. Nothing wrong in my delivery, doctor.
All right. So was that your first pregnancy?
Yes.
You know the weight of your baby?
It was around 3 kg.
Were you able to pass the urine afterwards? I mean, after delivery?
Doctor, I was in a rush, so I came to home after 4 hours, and I didn't pass urine in the hospital.
So at home, was it
Yeah, at
pain-free?
home, everything was going fine. Initially, I was having some pain while passing urine, but now then after that, I was okay. But
Were you
suddenly in
able?
the morning, that I was
Mhm.
unable to pass urine, and then it all happened.
Okay. So were you able to empty your bladder completely at that time, right?
Yes, doctor.
What was the stream of the urine? Was that thin stream or any interruption in the stream?
I felt that the stream was a little bit poor. It was not coming as fast as it should be.
Mm-hmm. And were you able to feel the sensation that you are feeling at that time?
Yes, yes, doctor.
Mm-hmm. All right. So this type of problem, it happened first time, or you had it before in the pregnancy or even before pregnancy?
No, doctor, this is the first time it happened.
Okay. Any burning or pain afterwards, after delivery?
I felt some burning while passing urine a day before, doctor.
Okay. And vaginal discharge?
No.
Mm-hmm. And how's your baby now?
Baby is doing well, doctor.
Okay, that's good. And did they ask you about tears at that time, like excessive stitches or difficulty in stitching of the wound?
No, they gave me a cut, but they said that because it's a first baby, most of the women get it, so that's it.
Okay. I would like to check your notes. Would that be okay?
Yes, doctor, that's fine.
Mm-hmm. All right. So, do you have any medical problems like
Mm,
diabetes or
no, doctor.
otherwise your pregnancy was uneventful?
Yes, doctor.
Mm-hmm. Are you allergic to anything, particularly latex?
No.
Okay. Apart from these cuts down below, do you have any surgery before lower down or in the tummy?
No.
Do you smoke?
No, doctor.
That's good. And your BMI?
It's around 26.
Okay. And what do you do for a living, Arnold?
No, I'm a homemaker.
Okay. And how is the support at home?
Doctor, my partner is very supportive, and he's
Mhm,
the one
good.
who's taking care of the baby since morning. And I'm really upset for him as well. So what could be the cause? I'm really worried.
If you need extra support, I can provide. Tell me if you need it.
Oh, thank you so much, doctor. That's so nice of you.
Okay. Would you like to add anything else apart from all the history I have taken?
No, doctor, that's okay.
Thank you very much. I would like to check you in the presence of chaperone. My nurse will check your general well-being. I will check your tummy and to see if you have any pain on palpation. Although the bladder is already empty, we passed the catheter, but I would like to check you if you have any swelling, pain, any discharge, or any excessive bleeding or anything abnormal. Would that be okay?
Yes, doctor, that's fine.
All right. Thank you very much. So after taking your history and examination, what I have concluded, you have a condition called postpartum voiding dysfunction. This is the retention of urine. Have you ever heard about that?
No, doctor.
Arnold, this is a condition that is common in almost 1/3 of the women, particularly if there is first delivery or the size of the baby is big, or if the patient they are having prolonged labor pains, they have instrumental delivery. But don't worry, help is always available. So I will involve my consultant and the specialist, the doctor in this field if need arises. We will involve the specialized nurse and a skin doctor.
Okay.
Would that be okay?
Yes, doctor, that's fine.
Do you have any questions up till now?
No, doctor, how you're going to manage me?
Yeah, so I will say what is the amount of urine that is after passing that tube. If that is less than 150, in that case, there is no need to worry. We will wait and see your next voiding. If the amount is more than that, then again after we will assess, means more than 150, we will assess you after 6 hours to see whether you are able to pass. If it is not, if it is between 250 to 700, in that case, you may need catheterization. That is the insertion of tube inside your bladder for 24 hours. And after that, we will assess you. And if you are not able to pass urine even afterwards, then and the amount of urine is more than 700, in that case, we will pass the catheter for 2 weeks, and we will assess you after 2 weeks. Are you getting me, Arnold?
Yes, doctor. So
Okay.
anything, so I have done wrong, doctor. This may be one of the cause that it happened.
It is nothing you have done wrong, but definitely I will check your records, and if there is any negligence from our side, in that case, we will initiate the incident report, and I assure you that we will be open, honest, and transparent about your case. Don't worry, Arnold, about that. Will it be okay?
Yes, doctor, that's fine.
And do you have any other questions?
No, doctor.
So I'm going to ask my nurse for the next step. And meanwhile, these are information leaflets. You can read about your condition. And I'm writing back to your GP as well. Thank you very much.
Okay,
Arnold.
doctor. Thank you
Thank
so
you.
much. Almost 1 minute left. You did very well. I changed the scenario because I just want you to, think, and that you very intelligently managed that. But one thing, you didn't exclude the infection. I told you I was having some pain and burning while passing urine for 2 days. You didn't ask me whether I'm breastfeeding. Maybe I'm just dehydrated.
Yes, ma'am. That is my mistake. Even you told in every case we have to exclude urinary tract infection. I told about vaginal discharge, but I totally forgot about urine test.
Exactly. So see, the most common things comes first. I changed the scenario because I just want you guys to think. It can change. It's not like the first person has it. So just think, and in exam, presence of mind is very important. Whatever the role player is telling you, she or he is guiding you towards the diagnosis. She is going to guide you towards the. I didn't tell I had a instrumental delivery. I didn't tell I had a big cut down below. So the pain is in. I told you that I was in a rush. I went to home early. I didn't pass urine, and I said there is something which I did wrong. I didn't say that there is something which you people have done wrong. See. So this is otherwise you were perfectly fine. Your history taking was very important. The most important thing was to exclude the infection. You have to tell me that first we are going to pass the urine just because we have to relieve your pain. I'll give you a painkiller. First, we'll to see that you are not having any infection, allergy, and you are not allergic to latex. Then we'll send the sample for the infection. Sometimes it can be just infection, and if it's there, we will be giving you antibiotic after checking your allergy and the one which are safe for you and for the baby. Full stop. If there is an infection, then we may need to do a culture, the result comes in 48 hours, and we can change or switch your antibiotic. However, if there is no infection, the amount of urine is less than 150 and more than 700, then you will do that management. So listen carefully what the role player is telling you. She is the one who will make you pass the exam. So this is my experience. Otherwise, your history taking was very good. You were very systematic. You know the subject. But these are the common mistakes, and still you have 2 months. So you can easily, these are not something which is a big blunder. But in the common things comes first. And listen to the role player. That's my advice to you. Otherwise, everything was fine. You know the information gathering. One more thing. Did you involve the colleagues?
Yes, ma'am. I told if need arises, I will involve the consultant and a specialist doctor in this field. call your
So my advice would be, once you tell her, in any case, in any case, if there is a communication with the colleague, just say that a group of a doctor is going to take care of you, which will involve my consultant, a urogynecologist, a specialist nurse. You are done. Just from the start. If there is in the 5 domains they have asked you, communication with the colleagues, multidisciplinary approach, this is the buzzword. And then 2-3 specialities in that. So you are done. Even if she comes after 24 hours, if she comes after 2 weeks, you have involved the concerned speciality. Okay. So before going, this is make your habit. Information gathering, examination, causes, and then that a team of a doctor is going to look after you. First, I'm going to pass a catheter. We'll give you painkiller. We'll rule out the infection. And depending, your further management is going to be dependent on the amount of urine we drain. That's it. Am I clear?
Yes, very right, ma'am.
Okay. So that's you will learn. Don't worry. This is the way you practice. If you start practicing like this, you have to finish one thing and then go to the other one. Just presence of mind is important. Very well done, both of you, Rekha and Shaista. I'm really impressed. Like, you guys are just, if you keep practicing like 4 or 5 stations per day, I'm sure you're going to pass. And know the subject, listen to the role player. Don't go for the recall that it's going to come as it is. You have to think that whether it's the same, she's telling me the same story or she's telling me another story. That's it. Okay. So just listen to her and you are going to pass. Any other question, anyone? So I think we are done for today. And if you guys need any help, you can ask the med institutors. If there is any specific topic you want to go for, we can do that as well. And just practice, practice, and practice. Thank you so much, Noor.
Yeah, thank you so much, ma'am. That was really eye-opening session.
Thank you so much. I hope
Thank
you
you,
people
ma'am.
liked it. If there is any specific topic you want to discuss, I'll be there to help you and I'll do whatever best I can do for you guys. Best of luck. Okay, bye from my side. This is the chart which you have to memorize, risk factors, and the concerned specialties. That's it. Thank you.
Thank you so much, ma'am, for the wonderful session.